And thank you, Arlene. That's all for our Bronx updates. We're switching gears now. This month's Pride Month celebration commemorates the 50th anniversary of the Stonewall riots right here in New York City. The visiting nurse service of the New York LGBTQ Community Outreach assists in lessening the stigma and discrimination among older folks within the Stonewall Generation, helping those who may be afraid to reach out to healthcare professionals or really just talk openly about their personal health issues. And joining us now to discuss community outreach, the upcoming Pride March, and the LGBTQ healthcare Bill of Rights is Arthur Fitting. He's a registered nurse at the Visiting Nurse Service of New York. Good to have you.
Hi, thank you so much for having me today.
Thank you, thank you. So as we talk about Pride Month, honestly, getting information out to this demographic and population is obviously a big push that you guys are doing. Talk to us a little bit about that.
Well, the Stonewall Generation, the generation of people who are in their 50s, 60s, 70s on up, really have great fear and trepidation in terms of revealing their sexual orientation. So reaching this population is very difficult because a lot of times they don't want it to be known who they are or where they are, and they do not access health care very freely. So we've been going to senior centers, community organizations, we've been going different places to do educational presentations on the LGBT Healthcare Bill of Rights, and trying to get people into the community where they are to understand that at Visiting Nurse Service of New York, they can receive home health care in a very safe environment.
Mm-hmm. You talk about knowing their rights, right? And sometimes they're not so familiar with it. Give us a little bit about the rights that they have that maybe they don't know about.
Well, the main point of the New York City Department of Health came up with these Bill of Rights, basically because the doctor who started this realized that many patients were approaching her saying that they weren't receiving the correct care. So the basic right is really to receive dignity and to receive gender-affirming care where they are. And also another point, there are 10 rights which people can access online, or they can go to the Department of Health site and download their own Bill of Rights. But also, there's also action that can be taken by the individual if they feel their rights have been violated. And that's simply to call 311 and report the incident to them.
Talk to me about healthcare providers, medical professionals. What can they do to make things better for the LGBTQ community?
Well, the idea is to really communication. That's really the important piece. Everybody at Visiting Nurse Service of New York wears our LGBT flag pins as a representation that people can talk to us openly about their sexual orientation and gender. And when talking to people in doctors' offices or in hospitals, sometimes there's a great reluctance to self-identify. So it's very important for the providers to understand that this is really something that has to be developed, that communication with the patients.
And from your perspective, do you feel like the wall is coming down a little bit?
The wall is coming down in certain places at certain times for some people, right? But there's a great deal of work left to be done with this.
And so we talk about medical professionals and really healthcare providers assisting the community. There's also the other part of the community actually knowing that these services are actually available. And so I know you go door to door and you've got people coming through. What do you find are some of the biggest challenges that you're facing during this time?
Well, I think one of the biggest challenges is definitely the communication, getting the word out. And also, many times they're family members, and many times they're neighbors who have an LGBT person living next to them and realize they're not doing well or they need some help at home. And they definitely can reach out to us at Visiting Nurse Service also and tell us that, to contact this person. We'll be glad to help.
I want to go a little bit into the Stonewall Generation, very important group, and talk about why you guys are working so hard to connect.
It's very important. The Stonewall Generation and the Stonewall movement actually took place 50 years ago this Friday. And it was basically after years and years of really being discriminated and a lot of stigma attached, and people couldn't live their lifestyles, that this riot broke out for 3 days. And that from that movement started the whole LGBT civil rights for the country and for the world.
So we want to let people know that, there's a lot happening. You can get connected. We're going to give you a little bit about information and resources to help you become more available in a few minutes. But for the last question I want to ask you is, what do you want people to know? And you get the final word.
That people should not be in fear or anxiety about trying to seek medical care or health care. A lot of times people are left alone. This group of people very rarely have family to support them and support systems. So we really want them to feel comfortable in reaching out to the Visiting Nurse Service of New York and really understanding that we'll provide safe care in their home for them without discrimination.
All right, Arthur Fitting.
Thanks so much.
Oh,
Nice
thank
being
you.
with you.
Visiting Nurse Service in New York. Thanks for the great work that you do.
Thank you very much.
All righty, listen now. If you want more information and resources, help is available for the LGBTQ community and the Stonewall Generation. You can visit VNSNY.org, or you can call 1-800-675-0390, or you can also follow them on Instagram at VNSNY. Taking a quick break. We've got more open. Stay with us. We'll come right back right after this.